when we think of teeth, we think of enamel, the part of the tooth that shows when we smile.
The outside.
And it's insanely hard, totally impervious to microbes unless it loses mineral, due to either dietary issues or what have you. The dentin, which is like 75-80% of your tooth, is like a sponge. It's totally porous.
Right under the enamel. Is that
right
correct?
within 2 millimeters.
Okay.
So, like, for people who have had a little bit of gum recession, when they look at their tooth, they'll see the whitish part of the tooth. That's the enamel, and then they'll see kind of more yellowy or orangey, thing and that's dentin. It's completely porous. If you go to like any dentist website, and they almost always have a why do teeth become sensitive, and they'll talk about, oh my gosh, it's because your tooth is porous and these nerves live in there, and it's really risky. They're so porous. But then we go and do root canals and somehow forget that it literally is a sponge. All the microbes that live in the mouth, once you remove the immune system's connection, now have the ability to infiltrate that sponge-like object called a tooth root. And it sits in your jawbone where it can then dump into the periodontal ligament space, and your lymphatics drain it. The little tiny capillaries that sit there can soak up those microbes. Studies have been done for well over 30 years showing when this is just chewing, mind you, when people chew for the next 30 minutes, they have elevated levels of the microbes that live within those crevices, the crevice between the gum and the tooth.